Welcome to Soda City Unleashed, where we decode pet health with some of the best veterinary experts in Columbia, South Carolina. I'm your host, Emily White, and today joining me, super excited to have Lauren Johnson. Lauren is one of CVETS' newly lettered Veterinary Technician Specialists. Welcome, Lauren. How are you?
Emily, I'm good. This is exciting.
Yeah, we've been actually, begging you to come on to the podcast since we started.
I know.
Right?
I know. I'm hesitant.
I totally
It's just
understand.
me as a person.
No, you're fine. And you also, I know you wanted to get through your testing and stuff for the VTS, which we'll dive into in a little bit. But will you tell me a little bit about your background? How did you end up at CVETS?
So I have been at CVETS for almost 4 years. I think April makes 4 years. My husband and I moved here back in 2022 from Hawaii. He's retired Navy, so we, finally got to pick where we get to live. My stepkids live here, so we're moving to be closer to family. And CVETS, when I was, the type A person that I am, planning our move 6 months in advance.
As one does.
CVETS was always on my radar as somewhere that I would like to try to work. And it worked out in my favor.
That's awesome. How did you get your start in vet med?
So I started from the bottom, like 90% of the people that get into the field. My very first job was as a technician assistant / kennel attendant. And then while I was in technician school, I worked full-time as a receptionist. So I've kind of done all sides of vet med. I did general practice for probably 2.5 years, 2 years of tech school, and then 6 months after. And then I made the move to specialty, emergency and specialty in 2019, and I have not looked back.
It's one of those things that, like, when you're in it, you're in it. Like, it's, we talk about this all the time, but it's a calling, right?
Yeah.
It takes a very special
very special person to do what we do.
Yeah. Well, congratulations are in order for your very new VTS, which is super special. Can you kind of explain what that is? So, like, we have regular vet techs, but then what is a VTS?
So a VTS is just a person, a licensed technician that has put in a lot of outside of work time, inside of work time, personal time to develop themselves as a nurse. There's a lot of different specialties that a technician can pursue, and they all have different like skills that you have to master, knowledge bases that you have to have. I would say critical care and anesthesia and analgesia are probably the two like most demanding. So to carry the letters and say that, yes, I am a boarded critical care technician is a huge kind of responsibility. We've put in all this extra work on ourselves to make ourselves better for our patients, but we're making ourselves better for the doctors, for our coworkers, for the pet owners, so that we can give their babies the best care that they deserve.
Absolutely. And I know when a lot of our veterinary assistants are currently like in tech school to become a licensed vet tech. Is it the same kind of thing? Like you have to go through a program in a school, or it's different?
It's all self-study.
Wow.
And that's what makes it, I think, an even bigger deal, because that person has like dedicated themselves to literally years of trying to become an expert in this field, in this whatever focus that they're looking at. And unfortunately for me, critical care, that means a little bit of everything.
Right. And knowing it quick,
and
right?
Trying to be able to recall, something that I read a year and a half ago that is currently pertinent. Like,
Sure.
Oh no.
Right. So your exact letters are Lauren Johnson, VTS, ECC.
Yep. LVT's in there too.
LVT is also, wow. Yeah. LVT, VTS, ECC. Love it. ECC is for emergency and critical care.
Yes.
What made you decide to pick that?
So it's actually kind of funny. When I decided to leave my general practice after tech school and move to a specialty hospital, I had actually made the move to pursue anesthesia. I made the move going, I'm going to get my VTS in anesthesia. This is it. This is the road I want to take. And then my surgeon left. It was probably about 4 months in, and my surgeon got a job she couldn't refuse. She moved off island, and I was like, okay, well, they don't need me with the other department, the rest of the department, the other surgeons fully staffed. So I guess it's time to move to the ER department. And it has just been, I mean, clearly it stuck. At the time, it was kind of devastating because I truly thought that that was the way I wanted to go. But it's really worked out for the best.
So you say off island because you were in Hawaii,
Yes.
right? And so at CVETS, I know the techs, the anesthesia techs kind of just like work with everyone. So you guys were like, you had a surgeon who you worked with, and when you couldn't like work with the other team, like it just...
So
that's
yes,
just how it worked, I guess.
Yeah, the other surgeon that had been there, she was just more established. Her team, she had her team, and
sure,
it just they didn't need another body.
Threw you into the emergency side,
and it, like I said, it worked out for the best.
Me personally, emergency terrifies me. It's like the same kind of terror as like a commission job. Like there's so much pressure.
Yeah.
What draws you to it? Like what is the opposite feeling of that?
It's awesome. The rush of, the stat triages that get called that are truly stats, and there's something that truly needs to be helped in this immediate moment. The post-operative cases that, you're sitting with for 2-3 hours trying to, restabilize their blood pressure, get them to a place where they might make it through the rest of the shift or the overnight. It's a feeling I can't describe because it's not joy and it's not like excitement, but it's just a rush.
Right. Oh, yeah, I can't imagine. Sometimes if I'm downstairs and I hear a stat come in, I'm like, I freeze in place. Don't move. Don't move, and it won't be real. Yeah. Is there when you think about, your career this far, is there a mentor or an experience or even a patient that's inspired you to take this next step to do all this self-study?
I had several doctors at my hospital in Hawaii that were really, really supportive. Going into the emergency department initially, I was very green, very inexperienced. Like learning medical math alone was just like, oh my God, what am I doing? But I had several doctors that were very like, let's do this together. One of my very first criticalists, she and I worked on a case that was a house fire. It was this really large dog that was involved in a house fire. He was stuck inside for many hours. So we were dealing with smoke inhalation, skin burns, things like that. He was probably my first true critical care case. And so she and I got to work with him. Unfortunately, it was only for about a day and a half before he succumbed to his injuries. But it was just a really amazing learning opportunity, and to be able to talk through the different processes that were happening with her and be able to like, holy cow, there's a lot. This is a lot. This is cool.
Right.
Obviously, it had a terrible outcome, but as a learning opportunity, it was amazing.
That's something too. You don't you don't see fire victims every day. Even I'm sure like in a human hospital, that's one of those things where you have to be like, okay, I read about this, like you said, 3 weeks ago. Let me try and remember how to do this. I guess that's part of the rush, right?
Yeah.
Tell me a little bit more about the process to achieve the certification of VTS ECC. You say self-study. So do you have to just like one day be like, this, I'm going to do this and this is what it's going to be?
Basically. So, it was probably maybe 6 months after I had been moved into my previous emergency department that I kind of, the light bulb went on. I was like, ooh, this is it. This is the way I'm going to go. So it's when you kind of feel like maybe this is what you want to do, you have to really just start putting yourself out there. Your doctors and your more senior technicians, those are the people that are going to mentor you and train you and teach you how to do the things that are required to fulfill the application process. Right. They're the ones that are going to answer your questions when, you're dealing with a new disease process that you haven't dealt with before. Why is the patient doing this? Well, blah, blah, blah. So if for emergency and critical care, it's kind of a multi-phased process. So there's a certain amount of hours that you have to be working in that specific role. So for critical care, it's like 3,000 and something hours, which kind of culminates in like 3-ish years of continuous emergency and critical care work. That doesn't include PTO. I learned that the hard way.
Wow.
So it's really like 3.5 to 4 years that you
Yeah.
have to be solely in that role, fulfilling that duty before you can even qualify to start applying.
Oh my goodness.
So you've got your working hours. You do have to be a licensed technician. You have to be licensed for that whole 3.5 to 4 year period. Letters of recommendation, things like that to kind of, that's your part A. That's the part where you just say, hey, I'm really interested. This is why this is why I think I'm qualified to do this. You send that in. The board, committee board, whatever you want to call them, they review it. And they get back to you a few months later and they're like, yeah, you're great. Or maybe next year when you've got a few more hours under your belt or something like that. The second part is the second most challenging part. The third challenging part is the exam. But the second part, your part B, is involved of 50 to 75 case logs. And basically what a case log is it's just 4 to 5 sentences, pretty brief, of interventions that you performed on a patient. Not going into great detail, placed an IV catheter, got a blood pressure, administered pain medications, just very minor things, but just showing your involvement in all these cases.
Right.
And then 4 case reports. The case reports are where you get really deep into like the pathophysiology of the disease process that the patient is dealing with. You talk about the lab work that was performed on that patient, how it responds to treatment. And then at the very end, you talk about all the pathophysiology that's involved. So there's a lot of nerding out, a lot of big technical terms and really doing a deep dive into, why this bleeding disorder is happening or something like that. Wow. And then once they accept all of those things, then you get to study even more to take a 3.5-hour exam.
Wow.
And then when you pass the exam, that's when you're done with the application. You can officially call yourself a VTS in emergency and critical care. And then now you can sort of like breathe.
Right. Yeah. You're probably still feeling that like, oh, it's over.
Yeah. I do still look at my scrubs in the morning and go, oh, that's me.
That's me. Those are mine. Wow. Yeah, that's very intense.
It's a lot.
Can you tell me what pathophysiology means?
So it's the basically just the process, the physiological process that's happening inside of the patient. So
why this is happening.
Exactly. So what like each step of the disease process looks like and kind of where that patient is in that phase of things. Wow.
And so, I mean, your job already is very like go. Mm-hmm. Like you have patients taken care of, but on top of that, you're also having 50, 4 to 6 sentences of, what you're doing here and like keeping track of all of that.
Mm-hmm.
That must have been
I had a lot of spiral notebooks, those little mini pocket ones. I probably had like 4 or 5 of them.
Really?
Yeah.
Wow. Was that, did you get frustrated, trying to keep up with all of that?
Yes.
Yeah. That's probably an understatement.
Yeah. Cause it used to have to be, I tried to do it daily, but let's be honest, that's not real. So I think it turned into maybe weekly or every other week type situation. I would sit down and like go through my spiral book and be like, okay, this is what happened with that patient. This is what happened with that patient, pulling up EasyVet on my computer from my house. Like make sure I have everything while it's still semi-fresh in my brain. And then I could sort of just, move on from it for a little while.
Can you talk about any like significant challenges you had just juggling all of this to end up getting this certification?
I would say the biggest challenge is just having any kind of work-life balance, because even though I wasn't at work physically working, getting paid, to do my job, I still would go home and I would sit at the the kitchen table and I would read, or I would be pulling stuff up on my phone while we were watching TV at the end of the day, trying to read on stuff. And my husband's like, "What are you doing?" And I'm like, "I'm trying to study."
Nothing. Don't mind me.
So I think mostly just trying to find the balance was probably the hardest thing.
Would you say it was worth it?
Oh, yes, definitely. It's for sure worth it. I wouldn't say it's necessarily changing or has changed my job. I feel like I've kind of already been in this role a little. I had to backtrack. I had to take my exam twice. After the first time I took my exam, the imposter syndrome really set in, and it was like, oh, I don't think I did very well. I don't think I'm going to pass, but hopefully I passed, but I don't think I passed. And when I found out that I didn't pass, it was kind of like, all right, well, that stinks, but I don't think I'm ready. It just didn't click
yourself.
yet.
Yeah.
I don't know. When I found out I passed this time, though, it was like, that's it. We're ready. Still not ready. Still fully devoted to my imposter syndrome, but it's less. It's a little less.
Okay.
I think. I feel like I fit the role.
Yeah. That's so interesting. Like, you kind of knew, you were like, I'm at this point, but maybe I just need a little bit more.
Need a little more time.
Yeah. So you mentioned you feel like you've already kind of been in this role already. Is there anything that stands out that's changed about the way you work with patients on a daily basis? Is anything like light switch change?
No, I don't really think so. Because like I said, I feel like I've kind of already, you've been working towards this for so long that you're already, looking at patients and trying to think as critically as possible so that you can anticipate what might happen or what the doctor might want. Now just having the letters, it just is, reinforces the fact that you've probably been doing an okay job.
Yeah. You deserve this.
You're probably doing okay.
Imposter syndrome aside.
Yeah. Everybody has it. It's still there, but you're probably doing okay.
Yeah. Can you think of a recent case where your specialization maybe made a difference in a patient's outcome?
So definitely from like my primary days to now, not even considering the fact that I'm specialized, but a few months ago we did have a French bulldog who had airway surgery. For the listeners, that involves some oral surgery. They do some trimming of the soft palate, and then they trim up the nostrils a little bit to kind of open up their airways. It sounds super benign, but when you're tinkering around in an already very small mouth of a French bulldog where they have all kinds of extra tissue, there's a lot of swelling that happens. Sure. So these are very, very dangerous. It's still anesthesia. They're still, being altered, surgically altered. So we had this French bulldog. He had come out of his airway surgery. He wasn't recovering the greatest. He ended up needing to have a temporary tracheostomy placed. I went in to check on him. He looked a little distressed. Listening to him, just even with not stethoscope listening, just putting my ear to his physical body, he wasn't moving air. And it sounded like he was trying to breathe through a little straw. So there was just so much swelling that had occurred that he wasn't going to make it without this additional procedure. So they took him right away. They did his temporary tracheostomy, and he went home probably 3 or 4 days later. Wow.
And so for people who might not know, a temporary tracheostomy, will you explain what that is?
Yes, sorry. So a temporary tracheostomy is an incision into the trachea. We place a small cannula. We'll call it a cannula. It's a small tube that fits into the trachea to help kind of maintain the patency of that incision. And it just hangs out there for a few days. There's temporary and permanent tracheostomies. The temporary ones, once we do like a breathing trial with patients, if we're able to pull the tube and they breathe well on their own without it, the site does close on its own over the course of like a week, I think. But they can be life-saving,
right? And
for
very
a lot
serious.
Of patients. And they're very serious. Yeah, they're definitely they're all surgical procedures are invasive, but it's definitely a extreme measure,
right? Especially for an animal who doesn't really understand what's going on.
Exactly, they're terrified.
Who does not understand what's going on.
Yeah.
So that's interesting. So like maybe someone like me, if I heard him or her breathing, after surgery like that, I would have thought, oh, it's just, they're swollen, like it's just a surgery. But because you have this training, you were like, no, something's not right here.
Yeah, you see enough of them recover and you know what the difference between, well, it's just a little swollen and maybe he's raspy from being intubated versus there's nothing happening, we need help now.
Right. Gosh. I've luckily never been around for a serious, like, get him into the OR right now kind of situation. I'm sure that's not exciting for anyone involved.
They're stressful.
Yeah. Oh, goodness. Well, I'm glad you were able to save that sweet Frenchie's life.
I know. He was a good one, too. Good boy.
Those surgeries, they're so interesting to me, especially to see the nostrils after they do it. It's literally like you went and got a nose job.
Yeah.
Like,
yeah.
Okay, so so we do have a critical care veterinarian, criticalist.
Yes. Dr. Gregory.
You could say. You will
You
say
would
that's
say.
what it is.
Yeah.
How do you collaborate with Dr. Gregory and some of the other emergency vets who, step into the ICU setting? How do you collaborate with them to make sure everything's going right and patients are being taken care of correctly?
For me, it's all about just asking questions and trying to be respectful. I am the nurse, so I don't make the final decision, but I am the one with boots on the floor. I'm putting hands on the patient hourly. Most days it's hourly. And I'm the one that's noticing the changes with them. So if I see something, I just call them and I go, hey, so-and-so is breathing a little differently, or they're more reluctant to get up and go for a walk this hour. What would you like to do? Or if I see something abnormal with the patient, I look at their chart and I go, hey, so-and-so's gabapentin fell off their chart. It looks like they haven't had it for 12 hours. Can we re-add that? If they say no, then there's a reason and we talk about it and then we just sort of move on. We come up with a plan, but it's really just communicating what I'm seeing with them so that we can all just sort of come up with the best route to move forward.
And you kind of have to have that open communication because your situations are 9 times out of 10 high pressure situations. So that's good that you're able to just talk to each other and figure it out. Right?
Yeah. And the specialty department doctors, I have a lot of internal medicine patients, a lot of surgical patients. They're all very receptive if, hey, I just want you to know about this thing. I'm kind of worried about it. If you're not worried about it, that's cool, but I am. So I'd like you to just know about it. Yeah. And then if you're not worried, we'll just move on.
Yeah.
But
having that air of respect for everyone.
Exactly.
Right. Okay, so something I know you're really good at. How do you use your expertise to mentor, support other techs or even veterinary assistants at CVETS?
I try to just gently provide guidance. We do have a really great training program. Christian is really awesome with getting our baby assistants, moved through with getting better at blood draws and IV catheters and that sort of thing. But if I see something that I'm like, hey, can I make a suggestion that might make this current activity a little bit more effective? A lot of times I get, sure, yeah, what would you do different? I am the go-to person when people need help getting blood or placing catheters. So if we have a really tough catheter that ends up going well once I go and, work with that patient, we kind of talk through what I did differently, that maybe made it more successful. I don't know necessarily that it's something that I'm doing or if it's just my years of experience. Right. It doesn't necessarily one way or the other, but we just talk through stuff like that and just gentle coaching.
Right.
I try not to shove information down people's throats. I have really big opinions on things, but I try really hard to be as compassionate as I can.
Love that. Love that. Yeah. I think too, in the ICU in the emergency room, there's a lot of opinions, and you want to be able to make sure someone's receptive and but also doing their best and doing the right thing. And,
right.
Yeah. CVETS is very much a teaching hospital, and I don't even think you have to be seeking out that to be taught something.
Yeah, exactly.
Yeah. Cool. What would you say is a common misconception about emergency and critical care that you'd like pet owners to know?
I feel like with this question, it's just veterinary medicine in general. when it comes to the technicians and the nurses, we do everything. And I know people say that all the time, but I just want to, beat the dead horse. We do everything. We draw the blood. We place the catheters. We take the x-rays. There's no other team that gets called. In human hospitals, they have like venous access teams.
Right.
I had no idea that was a thing. We don't have that. That's us.
Right. The vein specialist. Yeah. And then the x-ray specialist. And
we don't have a nutritionist.
Right.
They exist. We don't have one, but we are the ones preparing their food, and we thankfully have pharmacy technicians, but we are still the ones that have to, make sure that we're giving the medication, and we do everything. Literally everything.
So,
but that's what makes it fun, in my opinion. I enjoy knowing as much as I can about all of my patients, and I feel like because we have to do everything, I have the full picture.
Sure.
I feel like that would get missed potentially in other
medical settings.
Yeah. Thanks.
Of course. I got you. Yeah, that is something. I mean, I feel like everyone says that, but you're right. Like, especially if you've been in a human hospital setting where you've seen all those different things, right? Like where the team come in to do the x-ray, and then it's a different person who's changing the catheters and a different person who's doing this. And in our ER, man, it's
I can't even imagine if we had that many people.
Oh, yeah.
We would be
I feel like it would slow things down.
No, we would be unstoppable. If we had not that many teams, but that many people, we would be unstoppable.
It'd be like, yeah. It's probably good for pet owners to know too that you don't just get into this career willy-nilly like this. This is, you guys care about these animals. You wouldn't be doing this if you didn't.
Yeah.
And you care enough to do all those different jobs. They're in good hands for sure. Do you have any tips for other vet techs who are considering pursuing a VTS?
Do it. Don't be scared. I was scared. I didn't want to leave my general practice because that was my safe place. And it was literally the best decision I've ever made. Just do it. If it doesn't work out, okay, try something else.
Absolutely.
Especially at a specialty hospital, there are literally probably 4 or 5 other departments that you could try. And they all have specialties. Surgery, medicine, rehab, there's nutrition. There's so many.
Wow.
Dentistry even. There's a lot that you can even do at that I think I'm fairly confident that you could complete working in a general practice. There's a lot of options. So do your research and just do it. Just try.
Love it. Emergency and critical care can be very emotional for the pet owner, for the pet, for the person working with these animals. How do you manage the emotional side of your job?
I run and I work out.
Okay. Oh, I thought you meant you run the other way.
No, it doesn't work that way.
Okay. You actually run.
Yeah.
Okay.
I'm physically active.
There you go.
Yeah. Where I'm a gross early bird. I have to be at work at 6, so I'm awake at 3. And I work out before I go to work because that's just how I get my brain ready to deal with the day.
Hold on. 3 in the morning.
Mm-hmm.
So when I wake up to go pee, you are getting up for the day.
Yeah.
Wow. All right.
Yeah.
So you get up, you work out,
and
then you go home, get ready for work.
I work out in my house.
Oh, love that for you.
That's probably the biggest benefit is that I don't have to go anywhere. We have some pretty good gym equipment at the house, but work out, go to work, do the things at work, leave, sometimes on time. Probably not, but sometimes.
When you can. Wow.
Yeah.
I know I feel better when I work out. There's science behind it.
Mm-hmm.
I'm not going to say I'm sure.
There
there is science behind it.
Yes.
So that's what helps you compartpartmentalize and, I mean, not even compartmentalize, but just deal with everything going on.
Yeah.
Do you feel...
Yeah. Literally.
Do you feel when you're at work, like in the ER and the ICU, you kind of are in like your brain is in that mode and you just kind of switch it on and off.
Yeah, work me and home me are not the same person.
Yeah.
It's a switch, and it's usually on during my 4 shifts. When I get home, it's still kind of on. It doesn't quite cut off. And then today is a day off for me. I have 0 plans so that my brain can just kind of be off and
that's healthy
and not do anything.
It's probably a lot work you and home you are a lot different now that you passed your test and you're done with the studying too.
Yes.
No more like flipping through your phone while you're watching TV.
It's a little more relaxed at home now. Now it's working on SOPs and planning out CE for the year.
It continues.
It does continue, but at least now it can be things that I want it to be.
Absolutely.
I can pick.
It's not up to a board or a committee.
I can pick topics that I want to talk about, or things that, maybe I still want to get better at. So doing a talk on it is going to make me better at it.
Sure.
But stuff that I can actually be like, ooh, I'm interested in that. Let's talk about that.
Yeah, that's cool. That's cool. One more question for you. If you could tell pet owners one thing about the importance of being specialized in this a veterinary technician specialist, what would you tell them?
I would just tell them kind of like what we've already talked about. It just shows that person is dedicated to this job. They're dedicated to what they do, and they want the absolute best for their patients. And if your dog was going under anesthesia with VTS and anesthesia, you have the best person making sure that your dog is going to be okay. Not that our other technicians are not amazing, but it's just that extra level that I think just should make pet owners just that much more confident and comfortable with what's happening.
Love that. Okay, I'm going to do a rapid fire, but I'm going to have to think about it because I didn't write it out. Cats or dogs?
Dogs.
Okay. Small dogs or big dogs?
Big. I have 3 big ones. I can't say small.
Okay. A blocked cat or bloat?
Blocked cat.
Okay. Orange cat or black cat?
Orange.
Okay. That's a hot take.
Mm-hmm.
Overnight shift or daytime shift?
Daytime.
Yeah?
I can't. I think I've done...
The 3 a.m. doesn't make you like...
No, it's not the same. Getting up early and staying up late are not the same.
Okay. Yeah.
I'll
have to agree.
I have done probably less than 5 overnight shifts in my almost 10 years, and every time it takes me like 3 days to recover.
Really?
I feel hungover. I just feel like a zombie for days.
Wow. Yeah.
I'm sure you get used to it.
There's also people that can like only sleep for 4 hours and be fine.
Yeah.
Like all those people need to work overnight shifts.
Correct.
They'll be fine.
Correct. Yeah. No, and my dogs don't tolerate it. They're like, oh, it's 8 o'clock. You need to be awake. Bro, I just got home. I need to go to bed.
No, leave me alone. Leave me alone. Yeah, they can't read a clock. They don't know.
They don't care. They're like, it's the sun is out. So we're awake.
Let's go on a walk.
Yeah.
Let's go running.
Right. Exactly. Yeah. So daytime.
Well, thank you so much for coming on the podcast. We're so glad you finally joined us.
I know. Thanks for having me.
Yeah.
I told you I would do it if I passed.
You
so
did.
Here we
you
are.
did. Here we are. Here we are. Well, we appreciate you.
Yes.
Until next time, give your pets an extra pet from us. And thank you for joining us for Soda City Unleashed.